Okay, so what I want to talk about today is the influence of pelvic and lumbar overextension on overhead position. Oftentimes we're seeing a lot of athletes have shoulder dysfunction, even elbow dysfunction, and a lot of that may stem from, I think, a lot of poor positioning and poor control of that anterior trunk. So if you're having pain up here, whether that's throwing, overhead lifts, etc., we need to really step back and look at how am I controlling my torso. If that rib cage is flying open and the athlete is overextended, their pelvis is anteriorly tilted, then that's going to influence their ability to control the thoracic spine, control the shoulder. So I think proximal stability yields distal mobility. So looking at if we're doing any type of exercise or any type of training for a specific sport, start first at the midline. Anterior core stability, so making sure that the athlete is properly aligned here. They're not overextending and flying open at the rib cage. They're squeezing, so we're squeezing our butt, we're turning our abs on, we're tilting that pelvis posteriorly, and getting good control here. One, so we can generate force. Two, we can then control the shoulder better in the overhead positions. Okay? If that means that you have to get into more of some flexibility to get out of this position, then we work on anterior hip flexibility. If it's posterior chain, we work on that. Those are all separate talks, but we really need to work on getting out of that lumbar extension. Get out of that first, then address the other issues, whether that's thoracic extension or shoulder rotation. All right?